If you or your loved one has had a brain injury and you're trying to figure out what is actually happening inside that brain, this video is for you. You have been told you have a traumatic brain injury, but nobody has really sat down with you and explained what that means, what changed, why you feel different, why some days are better than others. I am Dr. Celeste Campbell. I am a licensed clinical neuropsychologist, and I have spent over 35 years working with TBI survivors in hospitals, in VA medical centers, in private practice, and in research. I have evaluated hundreds of people with brain injuries, from mild concussions to severe TBI. And the one thing I hear constantly from survivors and families alike is, nobody explained this to me. So that's what we're going to do today. I'm going to explain what traumatic brain injury actually is, what happens inside the brain when an injury occurs, and why the effects can be so wide-ranging and sometimes so confusing. Stay with me, because understanding this is the first step to everything else. A little about me, quickly. I did my postdoctoral training in rehabilitation neuropsychology at National Rehabilitation Hospital in Washington, D.C. I spent years as a neuropsychologist at VA medical centers, working specifically with veterans who had traumatic brain injuries, many of them combined with PTSD. I've also done research on TBI, trained other clinicians, and served on state and national advisory boards for brain injury programs. I tell you that not to impress you, but so you know where this information is coming from. This isn't a Google search. This is 35 years of sitting across from real people whose brains were injured and helping them and their families understand what happened and what to do next. And that's exactly what I want to do for you here on this channel. One of the most confusing things about TBI is how different it can look from person to person. Two people can have what looks like a similar injury, and one goes back to work in 2 weeks, while the other is still struggling a year later. Why? Well, several factors influence how someone recovers from TBI. The location of the injury in the brain matters, because different regions control different functions. Injury to the frontal lobe, for example, often affects planning, impulse control, and emotional regulation. Injury to the temporal lobe can affect memory and language. Injury to the brainstem can affect basic functions like sleep and arousal. Pre-injury factors also matter. Age, overall health, prior brain injuries, mental health history, all of these influence recovery. And I'll be direct about something. Mental health history is not a reason to dismiss someone's TBI symptoms. It is a reason to take them more seriously and to look more carefully. Access to appropriate care matters enormously. TBI recovery doesn't happen automatically. It happens with the right support, the right rehabilitation, and the right understanding of what is going on. And there's one more factor that almost never gets discussed, but that I've seen matter over and over in clinical practice: whether the person and their family understand what happened. When people understand their injury, when they can make sense of their symptoms, they are better able to manage it, communicate about it, and advocate for themselves. That understanding is not a luxury. It is part of the treatment. TBI can affect virtually every aspect of how a person thinks, feels, and functions. So let's get into it. What is a traumatic brain injury? A traumatic brain injury, TBI, occurs when an external force disrupts the normal functioning of the brain. That force can be a blow to the head, a jolt, a blast, a penetrating wound. The key word is external. Something from outside the body causes damage inside the brain. Now, TBI is not one thing. It exists on a spectrum from mild, which is what most people call a concussion, all the way to severe, which can result in coma or permanent disability. And there's moderate TBI in between. Mild TBI is by far the most common. And here's something important to understand right away. Mild refers to the injury severity at the time it happens. not to the impact it has on your life. I have seen people with so-called mild TBI whose lives were significantly disrupted. The word mild can be really misleading, and I want to name that right at the start. Severe TBI typically involves loss of consciousness for more than 24 hours, significant memory gaps, and often shows up clearly on brain imaging. Moderate TBI falls in between. But mild TBI, a concussion, may involve only brief or no loss of consciousness, and it often doesn't show up on a standard CT scan or MRI. That's where a lot of confusion starts. When the scan looks normal, and some people, including some medical providers, conclude that nothing significant has happened. But something did happen, and that's exactly what I want to explain. The brain is extraordinarily complex. It is not like a broken bone where the damage is visible and healing is relatively predictable. Brain injuries involve multiple mechanisms, and that's why the effects can be so varied and so puzzling. Let me walk you through what happens at the moment of injury, and then what continues happening in the hours, days, and even months after. At the moment of impact, the brain moves inside the skull. Even if the skull isn't fractured, the brain, which is soft tissue, suspended in fluid, can be shaken, twisted, or compressed. This is called the primary injury. It can tear nerve fibers, damage blood vessels, and cause immediate cell death in the injured area. But here's what most people don't know. There is also a secondary injury that unfolds over the following hours and days. The initial trauma triggers a cascade of biological processes: inflammation, swelling, changes in blood flow, release of toxic substances. This secondary injury can actually cause more damage than the initial impact, and it's one of the reasons why symptoms can appear or worsen after the injury, rather than immediately. Now, there's a specific mechanism in mild TBI that I want to explain, because it helps clarify why concussions can have real and lasting effects, even when imaging looks normal. The brain communicates through neurons, nerve cells, that have long fibers called axons. When the brain is shaken or jolted, these axons can be stretched and damaged. This is called diffuse axonal injury. It's not a clean break in one place. It's a disruption scattered throughout the brain's communication network. Standard imaging often doesn't detect it, but the person feels it. They feel it in their concentration, their memory, their mood, their energy. So when someone says, "I had a concussion, but my scan was normal, why do I still feel like this?" This is the answer. The injury is real. The scan just wasn't sensitive enough to see it. One of the most confusing things about TBI is how different it can look from person to person. Two people can have what looks like a similar injury, and one goes back to work in 2 weeks, while the other is still struggling a year later. Why? Well, several factors influence how someone recovers from TBI. The location of the injury in the brain matters, because different regions control different functions. Injury to the frontal lobe, for example, often affects planning, impulse control, and emotional regulation. Injury to the temporal lobe can affect memory and language. Injury to the brainstem can affect basic functions like sleep and arousal. Pre-injury factors also matter. Age, overall health, prior brain injuries, mental health history, all of these influence recovery. And I'll be direct about something. Mental health history is not a reason to dismiss someone's TBI symptoms. It is a reason to take them more seriously and to look more carefully. Access to appropriate care matters enormously. TBI recovery doesn't happen automatically. It happens with the right support, the right rehabilitation, and the right understanding of what is going on. And there's one more factor that almost never gets discussed, but that I've seen matter over and over in clinical practice: whether the person and their family understand what happened. When people understand their injury, when they can make sense of their symptoms, They are better able to manage it, communicate about it, and advocate for themselves. That understanding is not a luxury. It is part of the treatment. TBI can affect virtually every aspect of how a person thinks, feels, and functions. I want to give you a real picture, not to overwhelm you, but because I have seen too many people dismissed or confused because they didn't know that what they were experiencing was connected to their injury. Cognitively, TBI commonly affects memory, particularly the ability to form new memories and retrieve recent information. It affects attention and concentration, processing speed, and what we call executive functions: planning, organizing, managing time, controlling impulses, and problem solving. Emotionally, TBI can cause irritability, depression, anxiety, and what sometimes is called emotional lability, where emotions seem to come on more suddenly and intensely than before. These are not character flaws. They are neurological effects of the injury. Physically, common effects include headaches, fatigue, a profound fatigue that is different from ordinary tiredness, sleep disruption, sensitivity to light and noise, and dizziness. And socially, this is the piece that often gets overlooked. TBI can profoundly affect relationships. Communication becomes harder. The person may seem different to people who knew them before. Families carry enormous weight and often have no idea why things feel so strained. We are going to spend a lot of time on this channel talking about all of these areas because each one deserves real attention. Here's what I want you to take away from this video. Traumatic brain injury is a disruption to the brain's structure and function caused by an external force. It exists on a spectrum. It can affect cognition, emotion, physical functioning, and social relationships. The effects vary enormously depending on the injury and the person, and the symptoms are real, even when the imaging is normal, even when others don't fully understand, even when it's been months or years since the injury. You are not imagining it, and you are not alone. This channel exists to give you the kind of clear, honest, clinically grounded information that can be hard to find, whether you are a person with a TBI, a family member, or someone who cares for people with TBI. If this video was helpful, please subscribe so you don't miss what's coming. In the next video, we're going to talk about the symptoms that often blindside families, the cognitive and emotional changes that nobody warned you about. I'll see you there.